So is there some retinal thickening? Yes, the retinal thickening is present. And what about the FA features? The FA features, as assessed before, found some staining but no leakage. So what about the fuzzy area? The fuzzy area here is very doubtful because it's questionable, but most, I think that here is reporting any doubtful because even among retinal specialists, it's not easy sometimes, and there is no agreement about the fuzzy area. So in this case, the algorithm asks, is there some retinal thickening? Yes, there is. Are there recent metamorphopsias? Yes, there are. And what about the RPE features? In this case, the RPE is still present, and with some focal interruption, as we can see here from the choroidal hypertransmission. So the algorithm asks to consider FA or, if available, an OCT angiography. And here we can see very easily that the lesion is present because we can see the neovascular network very clearly. So let's go on with the last case. Here we have a patient coming for a scheduled control with an uncertain vision loss. And the first question of our algorithm is if the fuzzy area is present. So here there is no fuzzy area because we can see that the lesion is not the area is not fuzzy. So is there retinal thickening? Yes, there is. And what about the metamorphopsia? So these patients with low vision are difficult to understand because if they always report to have vision loss. The matter is, if we decide not to believe him, then we are facing an inactive lesion. But if we decide to believe him, the algorithm asks, how are the RPE features? And here we can see that still there is the RPE plan, the band is still present, and with subfocal interruption. So the algorithm asks to consider the FA features, and we can see that there is some staining, but not leakage in the late phases. Even if we consider the algorithm with the fluorescent angiography features, we can see that the conclusion is the same. So the lesion is basically inactive. Here we have some references. So, in conclusion, can we draw a diagnostic algorithm? Yes, we can. Can we do it without fluorescent angiography? Yes, we can. Can we do it infallibly? Unfortunately, we cannot, because the positive and negative predictive values of our paper, in our experience, is about 90%. Can we do it without the clinical examination? I don't think so, because to understand the patient is still very important. And can we do it without artificial intelligence? I think that to date, the role of clinicians is still very important versus the role of the devices. So I guess that the clinician plays a role which is very important. So thanks for watching. Everybody is invited to see our clinic based in Milano downtown. where we are more than 40 ophthalmologists working there. Thank you very much.
Thank you very much. Is there any question in the... Yes?
Hello, Nick Bear from Liverpool. When assessing these myopic CNVs, we're often looking for change from the last visit. Does your algorithm take into account change from the last...
Change reported by the patient, you mean?
No, change on the OCT.
Yes, of course. Well, there are patients which are difficult to understand and to conclude their proper diagnosis, especially if you do not perform the fluorescent angiography. Basing only on OCTs, sometimes I think it's very difficult. But in my experience, it's very important to rely to the patient because especially if they have low vision or even if they do not have low vision, if they report a new metamorphopsia, I think probably the lesion is active. So I prefer in these cases to perform an injection more, or even reconsider the patient in 1 month or perform a fluorescent angiography. But I think the patient, in my experience, is always right, unfortunately, in these cases, in myopic CNV.
We have to go. Maybe at the end of the session we have time to discuss that. Thank you very much.
So the next speaker is Dr. Ferretti from Italy about long-term outcomes of anti-VEGF therapy for a myopic CNV.